On Tuesday, we admitted a patient through our emergency department for a concern of COVID virus, and it was a well-coordinated effort. The patient had called his primary care doc, followed our current procedure of calling infectious disease, who agreed the patient should come to the ED. He was brought in by ambulance. The ambulance crew followed all procedures to keep themselves safe. The patient was seen in our ED and determined he needed admission to the hospital. The coronavirus test was sent to the state lab. The patient was appropriately admitted to the hospital in isolation. And late yesterday afternoon, the test came back from the state of Vermont. The patient is a presumed positive. At this point, all testing that's presumed positive goes on to the CDC for follow-up. That has occurred, but the patient, we do believe, does have coronavirus and is being cared for that issue right now. We've been preparing for our first case of coronavirus for weeks. Our team is well prepared. We have strong plans in place. We've been modifying those plans daily as the situation changes, following CDC guidelines and working hard with our network affiliate partners, the City of Burlington, the State of Vermont, and the CDC. So we are prepared to take care of more patients as they present, and we are modifying our policies as appropriate for where we are within this epidemic.
I really want to thank every single one of our employees, as Dr. Leffler said, for their contributions during this challenging time. I am so grateful for the effort, the extra effort that they have all put in, and I'm so proud to be a member of that healthcare community. As the healthcare delivery system for the region, this is what we do, and again, as Dr. Leffler said, we are prepared. Our thoughts are with the patient that's here at the UVM Medical Center, their family, and with all across our region that are impacted by this pandemic. As a healthcare organization, we're fully aware that we're the last line of defense, and our workforce must be protected to ensure we are safe and healthy to care for our patients and folks in the region. We're working directly with the Departments of Health in both New York and in Vermont, and we're closely following the CDC guidelines for all aspects of our response to this pandemic. We've instituted, for instance, for an example, we've instituted travel and meeting policies as an organization to protect employees and the public to the extent possible. We know that one of the most effective ways to reduce the spread of the virus is what is being called through the CDC social distancing. In lay terms, what does that mean? It's pretty common sense, but it means that we should be staying approximately 6 feet apart from each other. We shouldn't be meeting in crowded, small rooms. Therefore, that's why we're out here in the glorious spring weather. We really believe that the social distancing and limiting the size of gatherings really is a critical element at this point to limit the spread. We've implemented some specific measures to facilitate social distancing. We will not have meetings within the UVM Health Network with employees of 25 or more in one place. And we've worked hard to use video conferencing and the good old telephone to try and connect our people so that we can make the management decisions and the board decisions that are necessary to move forward in these challenging times. We're eliminating travel for work and discouraging personal travel. That's very consistent with what the CDC is talking about. And additionally, we've revised our UVM Health Network visitation policy that will be implemented later today for network hospitals in Vermont and New York. And again, at a network level, we're trying to bring consistency so that those interacting with any of our healthcare organizations will be getting the same message, the same directions, again, to the extent possible. As you know, things are moving incredibly quickly. And we're, as Dr. Leffler said, continually monitoring the situation as it evolves. The CDC and from the departments of health, information is changing almost on a moment-to-moment basis, and we are plugged into that. So undoubtedly, we'll be back in front of you. We'll be adding recommendations, modifying what we're bringing out, which is today the best thing to do, but tomorrow we may have more information and we will modify that for our folks. So again, I want to thank you for your efforts. You are a critical link in getting this type of information out to the public, along with the websites at the CDC, website of the Department of Health. For our healthcare organizations, people can go online.